Hello, and welcome to Here for Health, your channel for healthcare and expert witness interviews. We're so pleased to have you on Here for Health for an interview with Dr. Carl Rothschild, who is in another state, but he is an expert and has written a book on red light therapy. So we're very honored to have him here, and we're going to ask him some questions. Let me introduce Dr. Carl Rothschild.
Hi there. Great to talk to you. I always love sharing what I know about red light therapy. Just to give you some perspective, I've been a chiropractor for 47 years. Started in the 70s when I was a bit of a hippie. Mm-hmm. And, I knew for sure what I wanted to do was to help people, as corny as that sounds. And that money wasn't my main focus. And I loved what I got when I would interview chiropractors before I decided to become one. And I never found one that wasn't thrilled being a chiropractor. And I said, that's what I want. I want that I wake up in the morning, I can't wait to go to work and to be of help. And if you'd like, I could go on and talk about my history, but if you have any questions, you're more than welcome to ask them.
I think your history has helped shape what you are, what you do, and how you do your work. So I think your history is a big part of it. So
okay, well then, about 26 years ago, at that point, I was 20 years in, give or take, and I was introduced to light therapy by, of all people, this orthopedic surgeon out of USC out here in California. And he told me, to shine a light on somebody and it would make a difference. Now, you got to understand that at that point, I figured I knew everything, and it was kind of unbelievable. I'm going to take something that looks a little bit more like a flashlight, shine it on somebody, and it's going to make a big change in their lives. And I didn't believe it, but he convinced me at minimum to bring it into my practice. And it revolutionized my practice. I couldn't believe, and remember that equipment that we had back then was thousands of times weaker than what we currently have. But even so, at that time, that was a state-of-the-art equipment.
Sure.
And we were able to heal things that I never believed possible. So this lady had gum disease, and she said, "Could you help me with my gum disease?" Now, I'm not a dentist. And the only thing we knew back then, 26 or something years ago, was that it couldn't hurt. That's the only thing we knew for sure. So what was there was no risk,
What's
right?
the problem? It's a risk-benefit ratio.
Yeah. So sure enough, we pinked, her teeth were, her gums were black practically. And within a couple of weeks, we pinked up her gums. Then this guy comes over and says, "You did such a great job with my brother and his back problem using at that time it was called cold laser. Could you help me with my kidneys?" Now, again, I'm not a kidney expert, although I know more about kidneys than most. And I treated his, and kidneys are very superficial, so it was easy enough to access, even with equipment that's not as strong as we have now. And we had very good success with him. And it just went on and on and on. And over the years, as you might imagine, in the world of technology, things get stronger, things get better, things get more able to handle more conditions. And then about 13 years ago, it turns out that there was an element of light that actually helped in shrinking fat cells. It doesn't damage the cells. It doesn't destroy them. If you imagine with freezing them or boiling them or lasering them or using ultrasonic cavitation or radio frequency, these are often about bursting the fat cells and essentially destroying them. Mm-hmm. As a chiropractor, that's not my belief. My belief is not destroying tissue if it can be helped, sure, not putting anything in the body that doesn't belong there or yanking anything out that does belong there unless there's no other resort. So imagine finding a way of helping somebody with their diet, which is all natural, doesn't hurt anybody. It essentially is using an element of only red light. None of the other wavelengths, none of the other stuff do anything for fat loss. It's red light. Now, ironically enough, when that was discovered, I wasn't using red light. I was only using near infrared.
Okay.
And near infrared is invisible to the naked eye, way more powerful from the healing aspect. So we never got any results with fat loss. We weren't looking for that. Mm-hmm. It was the red light. There was this one red light company that was using red light for healing, And we didn't want to tell them, hey, buddies, you're doing it wrong because it's not red light, it's near infrared for healing. But they're the ones that discovered that there's actually an element of red light that will helping with fat loss. And again, even back then, they didn't know how it worked. They thought it liquefied the fat or something like that, but they weren't sure. All they knew, again, is that it couldn't hurt. And I'm going to go over how these things work in just a moment. But just to move on with the history, about several years ago, there was this thing called COVID that affected all of us. And in particular, my practitioners would contact us. And at that time, we had hundreds of locations all over the country, working with lasers and pads and panels and whatever and what I may have not mentioned is once I heard about this fat loss thing, I got involved with manufacturing because I wanted to be involved in a even bigger way. So we were making these different variety of equipment, but when COVID hit, our practitioners wanted a way of treating somebody with less physical contact between the patient and the provider. And we came up with the bed, which looks something like
other side. There you go. Yeah, one of those.
So on one screen, it's anyhow. So at any rate, with the bed, and this is about the sixth rendition of the bed. We started off. Our first bed was state of the art at the time, but we've made many improvements of that since. But at any rate, we shipped out the beds in the beginning, and just thinking there would be a nice substitute of what we were doing up to that point, not thinking that it was going to have much different results than what we were doing. But within a month of us having delivered the first series of beds, we were getting feedback that was unbelievable. So like this one guy, he was having a heart attack once, if not twice a week.
Ooh.
And this was going on for over 12 years. So 12 years ago, up until that 12-year point ago, he was already obviously in very bad shape. And so they had implanted a defibrillator so that every time he would die, it would zap him back to life. So he died hundreds of times by the time we met him. So he was a mess. He was dying, quite frankly. I mean, his congestive heart failure was severe, no energy, and he was depressed. I mean, imagine he had been an athlete prior to this, and now
wow.
he wasn't happy. Let's put it that way. So the provider called me up and said, should I even treat him? I don't want him having a heart attack in my office.
Sure.
What should I do? And I said, you know what, let's just treat him for 5 minutes, stay in the room the whole time, and let's see what happens. One thing we know is it couldn't hurt. And we hear that again and again and again. And in fact, in a little while, we'll talk about side effects and contraindications. And we'll talk about that later, not right this second. So at any rate, the patient gets that 5-minute treatment, goes home that night. That was nearly 2 years ago. Hasn't had a heart attack since.
That's pretty impressive.
2 years ago. And so hundreds of heart attacks, no more heart attacks. So did you expect, if you think I expected that, I didn't.
I don't think
if
anyone
you think
did.
I was going, yeah, we're going to cure his, his heart issue. We just thought maybe it could help.
Yeah.
But his erectile dysfunction, everything that was wrong with him, and I might be exaggerating with the word everything, but almost everything has come back to life. He's as close to normal as possible. And his energy is, as he described it, is through the roof. And I'm just giving you one of dozens and dozens of testimonials that we get from people that are incredible. I was not expecting these, but now that we learned how and why it worked, remember, they didn't know why. Very often when scientists learn and discover new things, they don't know exactly why it worked in the beginning. So at any rate, and then we have people with Lyme disease. We had this one guy, Steve. He had contracted Lyme when he was 12, and it ruined his life. It ruined his childhood, his education, his social life, and of course, no career. When he's in his 50s, so 40 years later, he gets into one of our beds. And I'm going to be sending you these testimonial videos that you're willing, you can share with whoever you'd like. And I'm thinking maybe I won't tell you what happens with Steve. When you get the videos, listen to the video on Steve, because it's like you get chills up your spine. I mean, it's that remarkable of a change for this guy's life, and it's wonderful.
Well,
Remember, I started as a hippie, wanting to help people, and now I'm hearing more than ever, thank you for giving me my life back. What could be better? That's what it's all about. I don't mind making money, but if I wasn't helping people like this, it wouldn't be as much fun. It is fun.
Yeah. Well, you mentioned when you say this gentleman that had improvement in so many areas of his life, like erectile dysfunction, are we talking about the trifecta bed? Are we talking about, was there just a localized area of infrared or near infrared?
We didn't get these results when we were doing localized treatment. It wasn't until we created the bed that we started getting feedback that was amazing. And what we learned is when you bathe the whole body, top to bottom, left and right, front and back, inside and out, when you bathe as many cells as possible of that person's body, that's when you get these results with Lyme disease, with shingles, with autoimmune disease, including psoriasis. We had one lady, she had 3 forms of psoriasis. She had guttate psoriasis, plaque psoriasis, and psoriatic arthritis.
Okay.
And the psoriatic arthritis was so severe that it created dactylitis, which means that her toes were like sausages when she woke up in the morning, and they were black and blue and very painful. And within 2 visits, that stopped. But then all the other symptoms that she had uveitis on top of everything else, which meant that one of her eyes the pressure was so high, it was like 180 and it's supposed to be closer to 10. And the only treatment that they had for her was injecting her right in her eye. And plus these eye drops that were very, very expensive for her. And within a relatively short period of time of using this light therapy, using full body, is when she started realizing that the uveitis was gone. Her kidney stones were not an issue anymore.
Wow.
I mean, she had 16 serious conditions, including not only Lyme disease, but including, as I said, the autoimmune disease, just one thing after another that was unbelievable. And she doesn't have any of those issues anymore.
Wow.
So I'm not sitting here and telling you I expected this. I didn't.
Sure.
I'm telling you that I was as surprised. I was hopeful, but I was just as surprised as anybody would be when you hear these kind of results.
Well, you mentioned contraindications, and I want to go into that. But the first question I have for you is when you talk about all of these diagnoses, uveitis, kidney problems, kidney stones, I think you mentioned also erectile dysfunction. Is there research that's been peer-reviewed on these particular diagnoses with the use of, and I need to know what wavelength are we talking about?
So first of all, I do recommend that everyone in the audience become very familiar with Google Scholar.
Okay.
So if you go to scholar.google.com, just go to Google and put in Google Scholar or something like that, and then put in the word, it's a phrase, red light therapy.
Okay.
You'll get 3.5 million entries. That means double-blind studies, research papers, articles, all kinds of stuff pertaining to red light therapy.
And these are published, peer-reviewed? Okay.
There's PubMed there. There's all kinds of stuff.
Okay.
Then, if you want to isolate even more so, you would go red light therapy and lupus, or red light therapy and any of the things I already mentioned, and many more. I mean, I think you'd be hard-pressed to find a condition that we haven't seen very nice results. So, number one, yes, it's been peer-reviewed. Number two, you know what? If it hadn't been peer-reviewed, and yet we're getting all these feedback and knowing that it couldn't hurt, then there's no one out there that shouldn't at least try 6 visits. That's what it takes to know whether this can make a difference in your life, whether you have Parkinson's, dementia, Alzheimer's, multiple sclerosis, whether you have all the autoimmune disease, including rheumatoid arthritis. We had a lady that had pretty bad rheumatoid arthritis. And prior to that, she was a professional dancer early on in her life. And then she kept up with dancing, and now she can't dance anymore. She couldn't even open the door to her front door because she couldn't work the key. So she had to knock on the neighbor's door and they would let her in. And within a couple of weeks of treatment, she was much better. I'm not going to say she was professionally dancing again, but within 2 months, she was back to dancing, not professionally, but she was back to dancing. And she didn't have most of the symptoms that came with the rheumatoid arthritis.
Sure.
So a lot of these things that I'm describing, they don't really have great answers for. And that's what makes this so much fun. The easy stuff, like any musculoskeletal problem, I don't care if it's a ligament, tendon, muscle, bone, joint, breaks, wounds, burns, all that, we see phenomenal results with those things. Those are easy.
Yeah.
The more extensive problems like Lyme disease and shingles, and we already talked about dementia and Parkinson's. We had a lady whose mother had such severe Parkinson's and dementia that she was really becoming a danger to herself and others, and they didn't know what to do with her. And they were ready to put her in a home, but they tried the bed as the last resort. Let's just try that. Sure. And getting her in the bed, as you know, Parkinson's is, the rigidity is unbelievable. So getting her in the bed was very difficult that first time.
Sure.
And getting her out of the bed just the first time was so much easier, they couldn't believe it.
Wow.
And within a month, she was able to get in and out of the bed herself.
Wow.
And she became lucid. I mean, she was communicating like she wasn't able to.
Cognitively, she was improved, you're saying? Cognitively, yes. Yeah.
Cognitively and every other way.
Okay. Well, one of my questions is, I had always thought that the penetration of your red light therapy is fairly superficial, so I'm confused about, and that's why I think I keep going back to the erectile dysfunction, because you're really talking about the vasculature of the penis and the groin, and I don't know how red light therapy could penetrate to that depth. That's my question, really.
So first of all, you got lights on the top and the side, on bottom, surrounding the entire body. Second of all, when we came out with these medical grade lights and had such remarkable results, there are a lot of copycat crap devices out there that are pretty much just superficial, but ours is not.
How deep can you
we're
penetrate?
Talking about penetration that it's not about every cell in the body, but we're trying to affect as many cells of the body as possible. And the results are nothing short of spectacular.
Well,
so disc problems, kidneys, I haven't seen, the depth of penetration doesn't seem to be an issue at all.
Oh, well, that's interesting, because one of the concerns I also had was, I wonder about the eyes. I mean, you mentioned uveitis being treated in the eye, and I am not sure if you would have any problems with conjunctiva or with any of the more superficial eye issues. In other words, clouding or any problems with vision after a therapy session?
Quite the opposite. If you have any of those things, this was made up for me. Can you read that?
Get in the bed. I presume we're talking about the trifecta bed, right?
Yes, that was made up by one of my staff members, because she knows that I'm insane with this stuff. Yeah. Every day, or at least a few times a week, I get calls from people telling me, hey, you didn't tell me it could help this or that or whatever.
You didn't know, you know.
So let me talk about a bunch of stuff. Number one, side effects. In the 50 years that this technology has been studied, there has never been a side effect.
Really?
Ever.
That's amazing.
You couldn't hurt anybody if you tried.
Wow.
Now let's talk about contraindications. There really aren't any. However, there are legal contraindications. But the reality is you can go in there. I told you about a defibrillator, pacemaker, any electrical component. You can get in there with metal or staples or whatever. Sure. Not an issue. This is not ultrasound or X-ray or something that can accumulate in metal or anything like that. It's a light. And if you can walk in the room in your home and turn on the lights and it doesn't do you in, which of course it wouldn't.
No, it wouldn't.
You can get in the bed. So to that end, I want to talk about contraindications and I want to talk about the eyes. So keep me on track here.
Okay, so I'll put it down. I'll write it down right now.
So with contraindications, there aren't any, but the one legal contraindication is a constant for many different therapies, and it's called pregnant women. And I'll tell you why.
Well, you don't know. That's the problem.
Even though we know that it would be helpful to the mother and the fetus, And if you're in countries where they don't have an excess amount of attorneys that'll try to sue you for anything and everything, they are using this for pregnant women. But in this country, where we have attorneyitis, an unbelievable excess in attorneys that will want to sue you for anything, if that baby comes out anything other than perfect, that's one of the most litigious communities, the parents of less than perfect kids. And they're going to want to sue somebody. So I tell them, you know, let's just not get yourself in trouble and stay out of it until after birth, and then get the mother in that bed as soon as possible, because especially C-section, they're going to recover so quickly, you're not going to believe it. In fact, I've tried to work with plastic surgeons. See, be honest with you, one of the objections to red light therapy is that it doesn't make somebody as much money as some other things like surgery, like hospital stays. So you're not going to see your typical orthopedic surgeon going, yeah, I want to make less money, let me get red light therapy in my practice. But plastic surgeons are different, and I'll tell you why. They can do the plastic surgery ahead of time. They're going to get their money out of that, and then they get them in the red light bed, and that person's going to recover so much faster, so much quicker. So for example, tummy tuck, it's very painful. People, I worked in plastic surgery centers using this red light therapy with great success, but they were being told, the patients were being told, hey, you'll be back to work in a week or two. With a tummy tuck, it can take a lot longer than that, and a lot of pain, and they can't straighten up. But if they would use the bed, their recovery would be much quicker, and any scarring would be even less.
Well, you also mentioned well, I don't think you mentioned it, but I read about body sculpting that is done with the red light therapy, correct? Did I
Yeah, if you remember, so I started off telling you that we got involved with lasers and things like that. That was the healing. And then about 13 years ago, we discovered that there was an element of red light that actually shrank fat cells.
Permanently?
Everything's permanent until it's not. So here's how, I wanted to answer the question about eyes before I moved on to how it works. Of course. And once you learn about how it works, it is permanent until the person eats more food than they need. So yes, of course it's permanent. You're taking the fat out of the body, moving it out. You're going to get it to the liver for use or elimination, and that's permanent. But now you have somebody that eats more calories than they need, they're going to put it back on. So it has to be paired with a smart program. I hesitate to use the word diet. There's not a lot of people that know as much about fat loss as I do. I was introduced to it when I was 9 years old, when my mother became an executive of Weight Watchers, and of course I never had a good thing to eat again at that point. But I learned a lot at that point, but I also, I brought it into my practice, not Weight Watchers, I brought the notion of weight loss into my practice.
Sure.
Because if I can get somebody to lose 40 pounds, their spine's going to do much better. And so that makes sense, right? It's not so easy, but when you pair a smart diet, which we'll talk about in a moment, well, I can talk about it now. A smart diet is calorically neutral. It's about how many calories you should have in a day. We're not so restrictive, because when you use the term diet, which is a mistake,
everyone goes, no,
but also it implies that there's a beginning and an end. And at the end of the diet, does that mean they're going to go back to the bad ways they were eating in the first place? But got them all this weight in the first place. So what we want to do is to not call it a diet, but a change of life, a change of lifestyle. So that they learn how to integrate a smart diet, which is not so restrictive. Doesn't mean you can never have dessert again. It will mean you're going to have less. You're going to have less starchy carbohydrates, simple sugars, sodas, and particularly alcohol. Alcohol is the worst for a fat loss program. Yeah. And for anyone that wants to lose weight, alcohol gets in the way, honestly.
Yeah.
So we talked about fat loss. You asked about, slimming and sculpting. So what we did was we were the first company to do that. We integrated red, which is about fat loss and some healing, and the near infrared, which is phenomenal for tightening the skin. So when we're doing fat loss with somebody, there is no sagging skin or stretch mark, none. Because the near infrared is going to tighten the skin and not allow that to happen.
I see. That's interesting. Very interesting. You must have quite a few people who are looking for reverse aging or getting rid of wrinkles and all that.
Oh yeah,
What-
absolutely.
what
We
is
call it
most-
we call this the fountain of youth.
What is the appeal? What group of people would you say are most attracted by these features? You mentioned surgical healing being very easily
Okay, now you got to
performed.
write these things down. So we got to remember we're going to go to eyes, and we got to remember that we're going to
I
go
have
over
that
how
here.
this works. So now I'm going to answer your question
Okay.
of who's most attracted to this type of thing.
In your experience, 47 years.
Well, now, I haven't been doing light therapy for 47 years, but
13.
who's, so in the world of light therapy, who's most interested? When I talk to marketing companies of like, what would bring the most, now I'm not in practice, so I'm talking about for all the facilities that I work with, what would bring them the most number of patients, the most from a marketing point of view? And would it surprise you if I told you it's weight loss? That is the most attractive thing out there. And if you spend any time at home watching daytime television, or probably nighttime as well, you'll see many commercials going on about injecting a variety of different drugs that I'm not even going to bring up,
Sure.
that people are using for fat loss. And so it's a very popular thing, and people will do sometimes some pretty stupid things to lose weight.
Yeah. Yes.
So you remember back in the days when they had fen-phen, and there were people dying from that. And when they realized that this drug, again, I don't want to mention the name of the drug, but the side effects, there's so many more pancreas issues or pancreatic issues from this drug that's supposed to be for diabetes,
Right.
but they've changed it around. Again, a chiropractor, I'm not interested in putting anything in my body that doesn't normally belong there.
Okay.
But some people don't mind doing that because they want to lose the fat no matter what.
Right. Now, I'm going to
But
interrupt
imagine
you,
if you didn't
Carl.
have to do that, how much
Carl, I'm
cleaner
so
and
sorry.
better.
I just got a little notice. We only have a few more minutes left, and I'm
I
fascinated.
got
to
2
listen
more
to this.
hours going on here.
Well, but the studio has what they
Take out
have.
your gun and shoot that guy.
No, he's perfect. He's wonderful.
Okay, so quickly, let's talk about eyes really quick.
Okay, I don't want you to forget, though. That's fine. Finish up the eyes, but I want you to have two pieces of advice that you can give our audience that they could take home and think about or do. So
I'm going
leave
to
time
give you
for that.
one piece of advice. Give me
Advice.
15 more minutes.
Okay.
So
Eyes.
I have tons of advice for people. I've seen tens of thousands of patients, and but let's do eyes, and then we'll come to that.
Okay.
If I had an eye issue, I would get into bed so quickly you wouldn't believe it. And I would not wear goggles. Remember, this is a light. It's not radiation. It's not any of that crap. And what in fact will happen is we're not talking about keeping your eyes open. I'm telling you that the light can get through your skull and get to the brain and help with joy. It will bring more joy to somebody. We don't have seasonal blues when you're using the bed any longer. So
That's right.
people, it's not as pertinent now that we're entering into the spring and summer, but during those winter seasons, people love the idea that they didn't have the seasonal blues. So it gets through the skull, gets to the brain, so it can get through the eyelid to get to the eye. So anything in the eye, you'd want to have great success with, including macular degeneration.
Yes, it has been used for that, yeah.
Macular
Macular
edema,
degeneration, yeah.
uveitis, glaucoma. How about floaters? I mean, we've seen phenomenal results with floaters where we had one guy who had floaters so bad, it blocked his vision severely, and now it's gone. The floaters are one of the easiest things for us to get resolved. And because we're doing full body, we're getting to the causes of some of the underlying problems.
Okay,
So that's why I'm recommending full body.
okay.
Go to the website. Where is it? Over here on
Yeah,
this side.
it's over there.
Trifectalight.com.
Okay,
Go to the Contact Us page. If you want to get a hold of me, you can just contact me there. On the left side of that page, you can ask for a location closest to you.
okay.
It just takes 6 visits to find out whether this is going to be effective for you. And
I
it's
gotcha.
pretty rare
How much
when we don't
is-
have somebody that has great results with that.
Okay, what is the average price per treatment?
There are 2 main reasons, two different things that determine price. So I had 12 practices. At my Beverly Hills location, we charge more. So location does have some influence there.
Sure.
And then the next thing is, what are you providing? And what is the license of the individual? So if you have a nurse practitioner, for example, who has a much wider license, then they can treat and advertise some very serious problems. If you're a massage, not knocking, but let's say a massage therapist, an esthetician, they don't have quite the allowance, so they might not charge as much. But the truth of the matter is, what somebody charges has something also to do with the ability of them communicating and collecting money. So I had many associate doctors, and I've had some that charged more than anybody else in the community and got it. And then I've had others that couldn't figure out how to collect the $5 copay from their patient. It's a mindset also. But the average charge probably is somewhere between $75 and $150.
Okay, so let's say ballpark 100, just because it's a nice round number. So we're talking about weight loss, for example, since you say that's one of the biggest, being something like 6 treatments to know if you're going to get any really results, and that would be like $600 investment initially.
Well, each office is going to have a different process. When I was talking about 6 visits, I was talking about I wasn't talking about fat loss. I was talking about the healing aspect.
Oh, okay.
With weight loss, that's a different thing, and because it is much, from a technical point of view, it's not as complicated. We're not dealing with neuropathies or whatever. So some facilities might not charge as much. They might have a 6-visit program that costs significantly less. I'm not in practice. Haven't been in practice for years, so I don't know what everybody's charging. To be honest,
of course not. I'm just
but
asking.
The easiest thing is to communicate with us at the Contact Us page and find the location and ask those questions and see what those people are willing to do.
Sure. Well, I think
But you know what? We missed, and I know that we got to go, but I missed the most important thing is, well, how does this thing work?
How does it work? Okay, you want to tell everybody how it works? I can
You have
tell
5
you what I
minutes?
read, but
Do we have 5 more minutes?
I don't. Yes, we should, he said.
Oh, okay.
Go for
Tell
it.
them, we'll slip them a 20. Anyhow, there are 2 completely separate mechanisms.
Re-enter the Zoom. I don't know if it'll let me, but if we re-enter the Zoom, we might get another 40 minutes or so.
Oh, okay. Well, did you hear what he said? He may
No.
be able to re-enter the Zoom. The Zoom automatically cut off. Is it running now, Mark?
Yeah, it's fine.
Okay.
Tell us when it
So
cuts
go
off.
ahead. Go ahead, and we'll find out where we end up. But
If it cuts
Go
off, I'll resend it the email.
Okay, so there are 2 completely separate mechanisms. On one side is the mechanism for fat loss. It was only discovered a little over 12 years ago, and that's a completely different mechanism. And back then, they didn't know why it worked. It just did. And but the mechanism for healing has been known for a lot longer. But the idea of the healing aspect has been known for a long time. But even with that, they didn't really learn the specifics of how it worked until more recently. Mm-hmm. And so from the fat loss point of view, what they learned is that there's an element of red light, and only red light, that will change the permeability of the fat cell wall temporarily. That means that the fat cell wall becomes more porous for like a day, and then it goes back to normal. So we're not damaging anything. There's no injury, no nothing. Uh-huh. And what has been found is that by changing allowing the fat cell wall to become more porous. Mm-hmm. I'm sorry, what?
Porosity, I'm sorry.
By allowing,
go ahead.
By allowing the fat cell wall to become more porous, you're going to allow some of the contents to leak out. And then with our unique protocol, we move the fat away from the fat cells through the lymphatic system and to the liver, eventually to the liver for use or elimination. So that's fat loss. That's easy and yet very popular. Now, on the other hand, what is the miracle wavelengths, which drives me crazy, I love this stuff, is the whole concept and idea about healing. And in the world of healing, we're talking about that our body is as affected by the sun as your trees and grass are affected by the sun. We don't have photosynthesis, but we have other mechanisms that are related to the sun. So sunlight can actually stimulate mitochondrial activity.
Okay.
And what is discovered is that the mitochondria is the powerhouse of the body. And we know that without a normal functioning mitochondrial system, you will not.
Oh, sorry. Let me try and re-enter the Zoom.
So right now we have talk longer than we'd like to. Well, not longer than we'd like to, longer than Zoom will allow us to talk. But I wanted to connect with you while we're doing this and trying to get Dr. Rothschild back on the line about the potential uses also in mood disorders like anxiety. And I think what Dr. Rothschild had pointed out is that the penetration, and I need to find that out, the penetration past the skull into the brain can make a difference in mood elevation, and that has been peer reviewed in the medical literature in the ivory tower of MDs, that it has been helpful in mood disorders, which I think is fascinating. I didn't know about the fat loss or body. I know about the skin shape, skin integrity increase. So that's been really, really helpful. I think that I don't know if we can get him back, but if you have questions that we weren't able to answer, you can certainly feel free to contact Dr. Rothschild through his email address of trifectalight.com, or you can call into here, or not call, but email and text into here, HEAR, and then the number 4, healthspa.com. And we can also do what we can to find out answers for your questions.